Good morning. My name is Eva, and I am the program coordinator for DataShare. Hola, buenos días. Mi nombre es Eva, soy la coordinadora del programa de DataShare. Y estoy aquí con Nicole Lezen y Nicole Young de Core Investments, que son co-anfitrionas. And I'm here with Nicole Young and Nicole Lezen, who are co-hosts for today. Welcome to everyone. We're excited to see you all here. I especially want to welcome and thank our interpretation team. So Stella Lorman and Stella Carrasco. You won't see them very much today, but they are critical to the team. So thank you for being here. And thank you to Nicole Young and Nicole Lezen for co-hosting today. Our very special guests include Elisa Orona, Executive Director of the Health Improvement Partnership of Santa Cruz County, Rita Hewitt, Program Manager for SafeRX at HIP, Amy Mancia, Program Coordinator for the Safety Net Clinic Coalition at HIP, David Brody, Executive Director of First Five Santa Cruz County, Allison Guevara, Social Impact Consultant at Cradle to Career, and Sven Stafford, the Principal Analyst, Administrative Analyst at the County of Santa Cruz. So super excited to bring this group of speakers together today. And I just want to go over who and what DataShare does for all of us in the county, for those who are new to the platform. Thank you. Since 2019, DataShare has been a central hub of information, providing interactive data with over 350 well-being indicators. This data helps tell the story of our community's strengths and gaps and progress on certain goals. So we're really excited about this resource, and it's serving every day more and more people in the community from a diverse set of cross-sector agents, from funders to students, public servants, and concerned community members. If you haven't gotten a chance to explore the platform, some of the main tools include reports, local progress, which we'll be talking a lot about today, relevant data to your program or the services you provide, and dashboards to track some of the indicators that are most relevant to your program or to your advocacy work. Thanks. And I actually don't get to, and I'm happy not to talk too much today. So I'm going to hand it off to this wonderful group of speakers, starting with Elisa. So Elisa is the Executive Director of HIP. HIP's mission is rooted in improvement of systems, quality, relationships, and access to care. And HIP creates opportunities for local health care leaders to make our community healthier. And Elisa, you're here to introduce Rita and Amy and say a couple words about our relationship with HIP and DataShare. So take it away.
Good morning. Buenos dias, everyone. And thank you for the introduction, Eva, and for all your work on behalf of DataShare Santa Cruz County. Thanks to everyone for being here this morning. As Eva mentioned, my name is Elisa Orona. I'm the Executive Director of the Health Improvement Partnership of Santa Cruz County, also known as HIP. And we are the nonprofit consortium of healthcare providers operating here in the county. So HIP has been an active partner in the launch and implementation of DataShare Santa Cruz County. The vision that we share with a wide range of partners in the community is that DataShare SCC would provide a central location for data about our county, since we knew that a lot of time was being spent searching for data on websites like the census, state data sites, and others. So we wanted to streamline and make more accessible data about our community. Also, as we went looking for potential vendors for a site like DataShare, we quickly realized that our partnership with the Healthy Communities Institute is that the site that we have through DataShare SCC can do a lot more, including highlighting programs and progress toward community goals around health access and health equity, but also that data that encompasses other factors beyond just standard healthcare data can be accessible to us. So today it's my pleasure to introduce Rita Hewitt and Amy Mancia, key leaders on the HIP team. Rita is the program manager of the SafeRX Coalition, a multi-sector coalition focused on reducing opioid-related deaths, increasing access to behavioral health and substance use disorder treatment. And in the past couple years, SafeRX has brought in to also address polysubstance and to address silos in hospital care and in the jails. I want to acknowledge that we've probably all seen the recent news that opioid deaths have risen during COVID-19. So clearly the work continues, and DataShare SCC will be a key component in sharing our local data and the progress that our community is making. Amy Mancia is HIP's program coordinator leading the Safety Net Clinic Coalition, a group of partners that represent our community health centers in Santa Cruz County. As Amy will explain, SNCC, as we call it, the Safety Net Clinic Coalition, collects data every year on the work of our local community health centers. Community health centers provide health access to 1 in 3 individuals in Santa Cruz County. And DataShare SCC has provided SNCC with a platform to share this data more widely with the community. And from the perspective of encouraging collaboration, it has been great to have the opportunity to leverage DataShare SCC as a tool to share the impact of community health centers and also to foster trust among the health centers to share data not only with each other, but also with the larger community. So thank you all for being here today to learn more about DataShare SCC. The site really is a collective investment, and it's meant to be leveraged by anyone and everyone in the community. So we hope today informs and supports you in all of you in your data journey. Thank you for leveraging DataShare Santa Cruz County in your work and for sharing this community resource with your peers and friends. With that, I will turn it over to Rita Hewitt, HIP Program Manager of SafeRX.
Hi, everyone. Thank you so much for having me today. And I'm really looking forward to sharing a little bit about how our coalition has been able to use DataShare.
Welcome, Rita, and thank you, Elisa, for really tying in some of those loose ends of how DataShare can be leveraged with our local community. Rita, SafeRX is a coalition dedicated to shifting the culture of prescription medication. And this past year, the coalition identified isolation and stress as key adverse factors for those struggling with addiction during the pandemic. I'd like to hear a little bit more about how the shared metrics, which is a key mandate for the coalition, helped inform the need to prioritize addressing isolation and stress, and maybe how this prioritization looks like in terms of action taken by the coalition. And if you expect to see any of the impacts of those actions reflected in your data, or if you want to speak to that component as well.
Yeah, great, thank you. And that's such an important question, I think, because for us all, the past 16 months have been just such a challenging time, but particularly those who have an addiction. Being in this pandemic, was really an unprecedented stressor and put a lot of stress on us all. And it's especially problematic when you have a substance use disorder, because those type of stressors can be real triggers for recurrence of use. And so we've anecdotally heard from a lot of people in that population that we work with that they really miss the in-person recovery community, like NAAA meetings. They were just taken away from them overnight. But some have seen positives in that, like the virtual models. So we're just trying to figure out how we can replicate this and continue supporting people through this transition, kind of back to quote unquote normal. And so locally, we've seen a significant increase this past year in fatal overdoses from fentanyl. They nearly quadrupled from 2019 to 2020. So we had 5 deaths in 2019, and just this past year we had 19. So we're seeing increases in fentanyl, designer benzodiazepines, And what I thought was interesting, when I meet with our county coroner quarterly, a little more often if need be. And when I met with her, we saw that there were 40 drug-related deaths just from July to December of last year. And that's 2 times the normal amount for fatal overdoses that we have. And so that kind of brought into my mind, like, what were people going through? That isolation, the stress, the coping using medication in that later part of the year when the pandemic was really kind of at its height. So I thought that was an interesting thing to keep in mind while I met with the coroner and, was analyzing her data. But to me, this increase just demonstrates the need for education, stress management, and most importantly, increasing human connection, which I think the pandemic really took a toll on people for obvious reasons. And so our local strategy and response is to be more inclusive. Like Elisa mentioned, we're including other things other than opioids, such as methamphetamine use, benzodiazepines. We just are highlighting that we need to look at this as a more holistic approach instead of opioids, because most of those fentanyl overdoses weren't with opioids, it was other drugs. And so we took action in several ways. The most important one, I think, is that we met with the Harm Reduction Coalition and UC Santa Cruz of California, and we co-created fentanyl education and awareness campaign, and those have been circulating among media and community partners, neighboring counties, and we're really trying to get that information out there about this new substance in our community, and we're using data to kind of back that information up. And we've also worked on creating empathy enhancing materials, and so we worked on those with PVPSA, and so those materials were aimed at really decreasing stigma and increasing empathy to ensure that people feel supported, worthy, and humanized, especially in the times like we are right now. And I think the most relevant thing to this group that is exciting is we have been working with this program called ODMAP. So that stands for Overdose Detection Mapping Application Program. And that is a data platform that essentially has the ability to collect fatal and non-fatal overdoses in real time. And that's across jurisdictions with the goal to mobilize a cohesive and collaborative response. So a proposal was submitted last year by our county, and I remember sitting at the health department. I think it was even the week before the lockdown happened, and Dr. Newell looked at me and said, "Yeah, I think we're going to have a shelter in place for this COVID outbreak." And I was just in shock. I was like, "Really? What's going on here locally?" And now I look back and kind of laugh at that day, but I remember that meeting was on ODMAP, and she was totally in support of it. And so just beyond COVID this past year, it was finally approved this spring. And so this is just such a critical resource to have real-time data, so we can reach the communities that are in most need. And that real-time outreach that we can conduct will allow us to do more warm handoffs, increase access to medical care, just overall wraparound services that support the human to help address the isolation and stress that they may be feeling. And so to your other questions, if we expect to see an impact in our actions reflected by the data, I do. I think that we have had some significant metrics that have been measured. I just want to get that, I'm looking on my computer, the right numbers. So 2 metrics that I'm really proud of is from 2010 to 2019, the number of opioid prescriptions in Santa Cruz County decreased by 50%. And during that same time frame, prescriptions for buprenorphine, which is a medication-assisted treatment medication, increased by 156%. And actually, we just found out last week that Santa Cruz is #1 in the state for all counties for prescribing medication-assisted treatment. So that's something we're really proud of, and that we've been able to track on the DataShare local progress page. And I just think it's really cool if you want, you can check out our page and see the increase in buprenorphine. It's like this kind of a trend, and then the other trend of writing for opioid prescriptions like that. So it's a really beautiful trend that we're seeing. So I hope that our actions continue to keep those trends going, and we can support these individuals. And I would say the biggest, I think one of the biggest issues that I've run into is for real-time data. That's been really hard to find and track data that is timely. For example, we couldn't produce our 2019 infographic till mid-2021. And that data was already, so we're in a totally different landscape. And I always reference this scenario of Monterey had the best outcomes, the best metrics and data for opioid-related deaths. But then the next year they had a huge outbreak of fentanyl and had one of the worst in the state. But we were still working off of the data from the previous year, just because, you know, the state, it takes a long time to process and assess those metrics. But Monterey has adopted ODMAP and has continued to be able to track that in real time, so they know what their landscape looks like right now, and they're able to send out help in the areas. And so I think DataShare just another great support to all these data points that make a story for our coalition. I think that's about it. Thank you.
Thank you, Rita, for sharing that experience and those insights. I think what I'm really hearing from you is, you know, that multiple partnerships, looking at data that affects the programs that each of those partners is working on has really helped coalesce actions that can make a difference right now. And, you know, DataShare's commitment in terms of the platform is that as soon as data is released, that we're going to have it up within 60 days. That's what HCI is committed to. And there is a lot of information from different sources, and having immediate data, I think COVID-19 has really highlighted that need. So thank you for sharing a little bit more about how that impacts your work. I'm going to ask Amy to hop on here, your colleague. Amy, your work at HIP focuses on improving health outcomes and access for Santa Cruz County residents who receive care through publicly funded programs such as Medi-Cal, and the uninsured through a coalition of services. SNCC clinics report their data to different places. How has having the data publicly available on DataShare affected opportunities for shared decision-making, resource allocation, and other types of collaboration? If you could provide some examples, I think that would be great to hear about.
Yeah, thank you for your question, Evan. I'm happy to be here speaking on behalf of HIP and SNCC. So Safety Net Connect Coalition is the cornerstone foundation of HIP's work. SNCC constitutes both operational leadership and medical directors. And we've been sharing our utilization data on DataShare for about 2 years now. Collecting this data has been a long goal of SNCC. In 2010, the coalition set out various goals for the decade to increase healthcare access through the Affordable Care Act, and some of those being to coordinate care effectively across levels of treatment, primary care, specialty care, inpatient, skilled care, and rehabilitation. Another goal set is to build a countywide quality improvement system to track health outcomes and identify opportunities for improvement. And so really HIP on behalf of SNCC has been tracking this data for over 5 years, and sharing our data has allowed us to understand the collective impact of the coalition. In 2017, released a 5-year impact report that tracked trends from the years 2012 and 2016. And as Elisa mentioned earlier, by tracking this data, we were able to see that more than 1 in 3 Santa Cruz County residents seeks care within the safety net. We were also able to look at our patient demographics. So over 67% of our patient demographic is Hispanic, and over 78% are considered low income, according to the federal poverty line as determined by the Department of Health and Human Services. It was also impressive to see that visits among the safety net have increased by 42% by the span of a few years, and mild to moderate mental and integrated behavioral health visits increased 48-fold from 2012 to 2016. Tracking these trends has been critical to information sharing of best practices to continue to expand and offer care to our most vulnerable populations within Santa Cruz County. The COVID-19 pandemic worsened pre-existing inequities in our communities of color and our most vulnerable communities. And the inequitable impact of the pandemic has been evident in all communities, and in particular Santa Cruz County. When we look at the demographics, residents of the South County region make up 29% of the county's population. However, 57% of those diagnosed with COVID-19 live in South County. Our Latinx population comprises 33% of the total county population, yet represent 54% of known cases, and simultaneously 94% of the virus exposure was due to person-to-person household contact. And this really points to the inequitable impact that the virus had, especially among those who comprise our essential workforce, members of multi-generational housing, and communities of color. And so as we've navigated through COVID-19 and had this data really public, we really thought of how do we leverage this and what questions do we have so that we can improve health outcomes for everyone. And some of the most asked questions from our coalition's leaders have been, how do we improve care coordination? How do we connect uninsured patients receiving vaccines to care? How do we improve health outcomes? And how do we close health disparities? And so tracking this data collectively has really amplified our work and allowed us to identify the need to track other trends that point to health disparities among race, gender, socioeconomic status, housing status, and beyond, so that we can work towards whole person care, trauma-informed care, to improve health outcomes equitably for our low-income community members, Medi-Cal populations, uninsured, undocumented, and most vulnerable communities. Thank you.
Amy, I think what you're speaking to is that incredible need for disaggregated data so that we can actually see a whole picture of our community. I'm wondering, just as a follow-up, as you're speaking with the coalition on key actions to take, how that disaggregated data has shifted your scope of action, or if it has, knowing the impact on South County Latinx residents, how has that shifted an action that the coalition has taken? I don't know if you can speak to that dynamic briefly.
I think one of the ways that I would say has shifted our actions is by just simply allowing us to re-identify new goals and that really target specific data. As I mentioned earlier, in 2010, there were some goals set out, and those were for the decade. And so now we're in 2021, and post the decade, post the pandemic, we're in this moment where we're recalibrating and asking ourselves, what did we illuminate, what did we achieve, and where can we deepen this work?
Great, thank you so much for your incredible work with the coalition. It's really great to hear a little bit more about that. And we're just going to move forward. We have David Brody here as the Executive Director of First 5 Santa Cruz County. First 5 Santa Cruz County invests in health and early learning family support to promote optimal development of children in the county with a number of initiatives serving residents countywide. Today, we're going to talk about Thrive by 3, a countywide initiative that invests in evidence-based 2-generation approaches to improve outcomes for Santa Cruz County's youngest children and their families. David, I'm hoping you can speak a little bit about how this public and nonprofit partnership uses shared indicators to track progress, and if you've seen any direct cross-sector advocacy efforts leading to the development of a system of care for our youngest and most vulnerable children.
Yeah, sure. Thanks, Eva. To start with that, I have to set up a little bit about how First 5 has historically utilized data in its program design and evaluation, which ties directly into the approach that we use collectively with our partners on Thrive by 3. So at First 5, we've always used community level data to help establish countywide goals and track progress. For over a decade, we've published an annual evaluation report, admittedly relatively low tech, a paper report with a PDF version on our website, which you can find on our website. It's published annually. But in that report, we do a number of things. We publish a number of community-wide indicators and trends that are meaningful to children and families that we serve and support. Trends and data indicators and trends that sometimes directly relate to programs and services that we directly operate or fund, or some combination thereof. And sometimes ones that only indirectly relate, but we just know and believe strongly in their import, again, to children and families in our community, and feel it's important to highlight those types of indicators as an indicator of well-being of children and families in the community. So, things that wouldn't surprise anybody, like the unemployment rate, median family income, the percent of children, in particular young children, who live in poverty across a number of different measures in the county. A really important one, the percent of children with health insurance, the percent of children with access to a primary care practitioner. So those are just a few that we highlight across the board in an early section of the report every year, and have, again, historically kept that as updated as we can on an annual basis, when we publish that report. And then within that report, we've always also highlighted some of those and other specific indicators, like the percentage of children with health insurance, or another one, the rate of substantiated allegations of child maltreatment by age, as they relate to specific programs that we fund and operate. In those cases, like our Baby Gateway newborn enrollment program, that ensures that every child born in a hospital in Santa Cruz County who is eligible is successfully enrolled in Medi-Cal and has their independent health insurance established before they leave the hospital. Another program, Families Together, a differential response home visiting program focused on reducing the risk of maltreatment in our community, child maltreatment in our community. So we link some community-wide indicators directly to programs and services that we fund, support, or operate. We've always believed that it's important to not only track program-specific outcome data, so data on the children and families directly served, but also connect that to the wider indicators of child and family well-being that, I think everybody on this call understands, really provide us with a North Star in terms of what we want for our children, our families, and our county. Now, that's just behavior of First Five, but of course, we've always worked in a collaborative fashion, and we work in the interests of all children and families in this community. So I think that ties directly into the approach that we've all collectively taken with respect to DataShare and utilizing that platform for initiatives like Thrive by 3. So with Thrive by 3, early on in as the collaborative was established, with a number of, the collaborative established a number of community-wide data indicators designed to do something similar, to act as a North Star, as I said, to steer our collective efforts to improve outcomes for our youngest kids and families. And some of those that were specifically called out for Thrive by 3 are, again, no surprise and very familiar to some of the other panelists on this call. The percentage of young mothers getting prenatal care in the first trimester is critical. The percentage of babies born preterm or low birth weight in our county. The percentage of eligible young children able to access subsidized high quality childcare in our county. And again, shared concern, the rate of substantiated allegations of child maltreatment with a specific focus on our youngest kids, infants and toddlers. And so, while it's a multi-year effort to select community-wide indicators to and invest in programs and interventions that will impact them ultimately, the indicators we selected did at the time and continue to influence our system of care design choices, including some obvious things like our early, even prior to the formal establishment of Thrive by 3, countywide investment in our home visiting programs. In particular, with tremendous leadership at the county level for the establishment of the Nurse Family Partnership Program, for ongoing and increased support for the Families Together home visiting program that I mentioned, that we with County Human Service Department have jointly funded for many years in our county, again, with that focus on reducing the risk of child maltreatment. So these investments have investments that have been made to provide enhanced funding for local child. Additionally, through Thrive by 3, investments that were made to provide enhanced local funding to subsidized childcare providers for infants and toddlers in particular. So really just an effort at the local level to improve the capacity of our childcare community to provide for their capacity to provide care to our most vulnerable infants and toddlers in the community. And then another thing that was influenced, and again, HIP in particular is very involved in this one, amongst many of the things I've said, is work that we're doing through Thrive by 3 to bring online evidence-based enhancements to pediatric care settings in the Safety Net Clinic Coalition through the implementation of an evidence-based program called Healthy Steps. Again, influenced by what can we do, what programs and evidence-based interventions are available to us across multiple sectors that can influence these key indicators that we've identified as critical to our community as North Stars for our collective work together. You know, and I would just wrap up by saying that's how Thrive by 3 has identified, prioritized indicators. It is a long-term project, as I said, to actually measure them and see impact on those over time. We definitely are challenged by what Rita referenced earlier. You know, the time lag in some of those key indicators. I think on the prenatal care work, it can be as far back as 2018 or even earlier that we have data from the California Department of Public Health. But it serves the same purpose in terms of this is what we care about. This is what we're going to organize our work around. And eventually, one will hopefully influence more better, if not real-time, appropriately timed release of new data for our community. And then, of course, hopefully, and eventually see the change that we want to see. And, you know, we're not obviously the only collective impact using community level data. The Oral Health Access Initiative led by Dientes and our Public Health Department has done a wonderful job of identifying key community-wide indicators that they want to address through strategic work in a collaborative, and we've actually seen movement on some of those key indicators around oral health access, in particular for young kids and young poor kids in our community. The Community Health Improvement Plan, which was a plan that is on the DataShare website that identifies a number of social determinants of health indicators that we collectively are committed to changing. And that was led through the Public Health Department and its accreditation process that it's been going through and is still ongoing. And of course, you know, near and dear to my heart, and you're about to hear about our Live Oak Cradle to Career partnership in the Live Oak community in Santa Cruz County. So it's not just Thrive by 3, it's this collective effort you're seeing across geographies, across sectors, utilizing data, all of these publishing it, almost all these publishing it on DataShare, that together we are truly contributing to an improved system of care for children and families in our county.
Thank you, David. Really a bird's eye view of how this plays out across the county with all of the partnerships, some of which you were able to mention and some of which aren't mentioned on this call, but hopefully we'll hear about in a future call. Thank you. And you led us into talking with Allison here. So welcome, Allison. The Live Oak Cradle to Career, or C2C, is a cross-sector, place-based collaborative with a mission to work collectively to empower families, deliver resources, and advocate for equitable and inclusive support systems to eliminate disparities and ensure that all Live Oak children thrive in their education, health, and character. One of the principles of C2C's community organizing model is to get informed and use data to drive results. Allison, can you talk a little about how this principle has served C2C, which is really a localized initiative, and provide an example about parent organizers with the Parent Leadership Committee of C2C leveraging data to address inequitable policies?
Absolutely, Eva. Thanks so much for inviting me. It's such an honor to be here with everybody. And actually, I just wanted to first circle back to Rita. And, you know, just share how much it means to me, the work that you're doing. I have a family member who struggled with addiction and passed away during this pandemic and was incredibly isolated in Florida. I couldn't be there to help him, you know, and that had a big impact on my well-being and my ability to care for my children. And I share that because this work is so interconnected, right? What you're doing is helping to create conditions for parents and families to raise their children in a healthy environment. And so I just wanted to begin with that. And I really feel like that is kind of the work of Cradle to Career, is to start exploring and working on all of those conditions that make it possible for families to raise healthy, thriving children, right? A lot happens at school, but a lot more happens at home. So just to kind of back up to Eva's question, I'm going to chat you all a quote from one of our parents, and I'll just read it to you. This is from Deanna. Some of you know Deanna. So she shared this with us. So through C2C, I discovered that I am an empowered woman, capable of doing incredible things. I have built strong bonds with the community, and we have worked together to support each other and change lives. So that's our goal, right? Like that's the impact that we want our work to have. So the question is, when we talk about being results driven and using data, how do we work with data in a way that gets us there, right? That's truly empowering, that's uplifting. And I kind of want to say that from the beginning that this is hard. There's a lot of things that make this hard. For one thing, most of us average parents, when we start looking at data, it's like, whoo, a lot of that's over our head, right? And so how do we make data accessible, visual? How do we make it inclusive in terms of language? And then I think most importantly, how do we work with data in a way that's strength-based, that doesn't throw the data in front of families and says, look at this disparity, like we got to work on this, because it's then that creates an identity and paints a picture that's already kind of bringing people down. So that's where we really begin with the question, what are our hopes and dreams for our children? And when we hear good education, good health, good character, then that's where we say, okay, well, like, what do we mean? And how are we going to measure success so that we know at the end of the day, children and families are actually better off because of our efforts. And I think that it's something that's like a very fluid, cyclical process where we're continually kind of going back to those questions. And Amy, you talked about this too in terms of recalibration because of the pandemic. Like we are totally in upheaval with our data, kind of how we're using data. Just so much of the assessments that schools do did not happen last year. Like the California Healthy Kids Assessment did not happen last year. You know, how do you measure literacy when it was this complete experiment with teaching through virtual learning, right? Like, so there's just a lot of kind of coming back to the drawing board in terms of how we define success. In our past, I will give you two stories of where I think that we did really well with using data. One was very early on in our initiative. We did share disaggregated data of kind of fitness. There was physical fitness testing in schools. And we were able to disaggregate that by race and by economic status. And I really feel like that's part of, our question to parents was, what indicator do you want to focus on? Here's a variety of choices, and they chose fitness, partly, I think, because we were able to see the disparities, that indicator. And so then what that resulted in was them coming up with an idea to have these free twice a week active family nights with free Zumba and free children's recreation activities. And it's such a beautiful thing. Before the pandemic, we would have 75 people in the gym at Live Oak Elementary dancing twice a week and building community. And so that was a real success, I think, and partly began with us, you know, being able to understand the data and make informed decisions. And then I think just the other example is for families to learn the significance of third grade reading as an indicator for later educational success. This whole concept of first we need to learn to read, because then we read to learn. And you know, during our pilot period at Live Oak Elementary, we saw a 31-point increase in English language arts scores. So there's something happening there, and we don't take all the credit for that for sure, but there is clearly like a kind of a growing commitment and engagement from families to help support the literacy development in their children. So I think those are kind of the main things that I wanted to share. And I guess lastly, I just want to end with where we're at right now in terms of the pandemic and data, and also just like seeing our impact over the last 6 and 7 years. There is a huge value that we are placing on people's lived experience, that qualitative data, the consensus that parents build through their monthly parent leadership committee meetings where they decide, you know what, access to recreation activities is what we really want to work on right now. That is a huge need for our children, both in terms of physical health and social connection. And so like really tuning ourselves to what we're hearing from the community as a really important source of data and finding ways to do that really effectively, in addition to being able to monitor those community level indicators, that more sort of rigorous sciencey kind of way of looking at data. So it's just kind of that balancing that we're in right now. So thanks so much for the opportunity to share.
Thank you, Allison. I think you really paint a picture of the people in our community doing the work on a day-to-day basis and how volatile that work has been in the last 18 months. And we are just starting to understand what the gaps will be moving forward. So I think that human connection that C2C really focuses on will be critical in that process to build a resilient future for all of our community members. So thank you for sharing. I'd like to introduce Sven. Welcome, Sven. So Sven, welcome, hi. I want to talk a little bit about the county strategic plan, which envisions a Santa Cruz County which is healthy, safe, and more affordable community that is culturally diverse, economically inclusive, and environmentally vibrant. A beautiful vision. For the county's next operational plan, there is a focus on incorporating equity and measurement into department objectives. So to achieve this vision, the county is committed to its mission of providing data-driven services. Data-driven doesn't always mean equitable. Can you talk a little about how the county is using both DataShare and the county data to create these equitable data-driven services?
Yeah, no, thanks for the question. And it's great to be here with all these great panelists. So I'll take a step back for 1 second. So back in 2018, the board adopted a countywide strategic plan. As part of that plan, there was pretty extensive community outreach that took place. And I think, that comes through in our vision and our mission and our values to be, transparent and trustworthy and accountable. But there wasn't a specific or explicit call out for equity within that plan. And so in the meantime, we've had obviously a global pandemic, a devastating fire, and then last fall, all 4 cities and our board of supervisors declared racism a public health crisis. And so as part of that, we were directed to find ways to be more explicit about bringing equity forward in our strategic and operational plans. And data plays a huge role in that. And one way that I've been thinking about it is that having data and disaggregated data starts eroding excuses for inaction. And so, I think it's hard to live in the county and not see or understand that the disparities exist. But if we don't have the disaggregated data to show us, then it always just leaves room for people to keep doing what they've always been doing. And so part of our focus is really on trying to get that disaggregated data to try to work with our community partners, which are most of you here, to try to keep making the change that we need to see. And so at the strategic plan level, we have population indicators, which are embedded on a page on the DataShare website. Those metrics, as far as possible, are disaggregated by various lenses of equity, race, ethnicity, age, gender, location. And then we're also investing at the county level, both in the content that goes to DataShare and in that disaggregation. And I think some key examples of those investments are our partnership with the core investments and the RFP that'll be coming forward in the fall. In our public health unit, we're going to be investing in more epidemiology capacity, standing up a population health unit that'll work with DataShare. Hopefully keep working with HIP and our local hospitals to look at our community health, to look at the social determinants, and more and more try to create avenues for community impact so that we're all rowing in the same direction. In terms of our operational plan and how we actually think about our own programs that we operate. We're looking at our at program indicators. We use at the county results-based accountability, which tries to just ask 3 simple questions: how much did we do, how well did we do it, and is anyone better off? And then through our partnerships that we're starting to develop with GARE, which is the Government Alliance on Race and Equity, and the Annie Casey Foundation, we've started asking this question, did we make a difference? So are we able to identify disparities and then create a tangible action plan to go and address that disparity? And so that's something that we'll be bringing forward. Some examples of this, I know we've talked about the disparate impact of COVID that it had on our community, especially in South County and the Latinx community. I think something that our community can be really proud of is on the vaccine distribution side, and all the work that public health did to, target and specifically go out to those communities that were more adversely impacted and get vaccine to them. If you look at sort of the social vulnerability indices and across the nation, you see that people who are most socially vulnerable not only are more susceptible to the disease, but we're also less likely to have access to vaccine. And in Santa Cruz County, that wasn't the case. You were just as likely to have access to the vaccine no matter what sort of strata you fell into on that social vulnerability index. And so that's one way that our public health took that data and actually put it into action, working really hard with new community partners and coming up with all sorts of creative ways to get vaccine out there. We've also been developing dashboards internally that we've also been sharing on DataShare. It includes looking at CalFresh, so the food stamp benefit that has a lag time of 1 month. So there's pretty accurate data on who's accessing CalFresh in our community. We also have one for substance use disorder that we've put out that has a lag time of about 3 months, but looks at successful treatment completions as a metric for how well we're doing in that program. And so we'll also, our new 2021 to 23 operational plan, we're currently working on it. It's going to be coming to the board for discussion on August 24th. And so, we're trying to have more of these types of objectives that embed equity, and more of these, and encouraging more of our departments to get involved with the disaggregation, the identifying the disparities, and creating action plans. And so I'd encourage everyone to look for that when it comes out in August, and give us any feedback.
Thank you so much, Sven, and thank you for being an advocate at the county for new systems and new actions. And it's great to see that result in the COVID vaccine distribution and say, look, we took a risk and it worked. So thank you for sharing that with us. Incredible resources, all these panelists, and all the work that you do in the community with each other and with other partners. Thank you for sharing. We're going to finish today's session with a best practices round robin. So there's so many things to say about the challenges of this work. And also, there's a lot to celebrate. So if you can share best practice that has been key to ensuring that local data is leveraged for progress in your work. We'll go around, starting with Elisa.
Okay, so the best practice that I'm going to share is telling a story backed by good data. So being really clear about what a data set is saying and the limitations of that data set, and then bringing the data to life with real life examples of what it tells us about people and communities and what we should be doing to make improvements.
Thanks, Lisa. Well, we can, Rita, I don't know if you want to add something.
Sure. Yeah, I think specifically for SafeRX, we do an annual infographic that depicts our progress annually. And we share it among key members, key stakeholders, community members, and we use this data to kind of track how we're doing each year. And so we have a comparison to look at, and we're deciding to kind of look at more measurements within that. So for example, to have more equity, such as race, age, location, things like that. And just another kind of thing that we started doing was humanizing these stories. So actually on DataShare, you can see that in conjunction with our data points, our graphs, there are interviews, quotes from interviews that we conducted of people with lived experience. And so I think that best practice really just kind of demonstrates the need for more equity and kind of just understanding, humanizing the story. So, thank you.
Thank you. Amy?
Thank you. I think the best practice I would share is moving and building trust among partners. And I think along with building trust is just identifying the best data source, and along with that comes data gaps. And I think just building in those who have lived experiences and are impacted by the data that we are exploring.
Thank you, Amy. David.
Yeah, I would pick one from a national campaign called the Campaign for Grade Level Reading, and actually Allison referred to it a moment ago. So picking a powerful indicator that helps focus multiple parties on a common goal, and one that hopefully is both not just important in and of itself, but serves as a proxy for a number of other really important dimensions of essentially child and family well-being. So, the grade level reading, as Allison described, is critically important for a child's ability to learn moving forward. It's also indicative of what's happened for that child and with that child in the past, and predictive of what's going to happen in the future. So finding those powerful indicators and really holding on to them and utilizing them to focus collective work is a great best practice. And I got to run because there's somebody outside my door, but I appreciate the opportunity to be here today. Thanks.
Thank you, David. Allison.
I'll just talk about something we're working on right now, which is a best practice around when we survey the community, sharing the results back with the community. And we're actually working with Eva and Sarah from DataShare right now on just kind of a guide to do that in a bilingual way, right? Doing a bilingual survey, sharing the results back in a bilingual way so that we can make informed decisions based on what the community has said. So we're going to hopefully have a guide available to share with our community that we'll put up on our website and on the DataShare website around bilingual surveys in particular. So I invite you all to check that out when it's ready.
Thank you. And Sven?
Yeah, I think just embracing sort of continuous improvement around data, and the idea that the first thing we put up online in our dashboards doesn't have to be the end result. It's something that evolves, especially when we're looking at equitable results or trying to provide services in real time. It's important to be monitoring, to be flexible, and to be able to admit that the first thing we did isn't going to be the best thing or the last thing that we do.
Great. Thank you. Incredible best practices. We're going to put up a poll. So we have a couple more minutes. We really appreciate your perspective on this panel, and hopefully it was helpful for you. So if everyone can respond to the poll as that comes up. And I just want to also say that we're really aiming to engage the community in being as data literate and as connected to our data resources as possible. We have a couple more events in our summer speakers and skill sharing series. So in August, we have how to create a visual report. This is a hands-on workshop. If you join, you will walk away with a report that has indicators related to your advocacy work or your program work, and in a shareable report format. And then our last speaker series of this session will be in September, in the beginning of September. It's about local data collection, filling the gaps and building local resilience. So really important work that's being done by UCSC, as well as by United Way and by Santa Cruz Community Ventures will be featured on that panel, with some focus on disparities around our Latinx community, our undocumented community, and our African American Black community. So really interesting work. Data that's not generally available is now becoming publicly available more and more, and that is the commitment that we have with our partners. So we really also want to celebrate that work because it's not easy to do. It takes capacity and commitment. So we're really excited for those next steps. Thank you all for responding to the poll. We are at time, and I want to respect the time for our panelists, and thank you all for joining us today. If you have questions about the panel or DataShare, feel free to go to the website or email us directly. And if you have questions for the panelists, you can put them in the chat. We'll stay on a couple more minutes for those who have time and those who have to hop up. Have a good day. And thank you so much. So we'll stay on for 5 more minutes. If any participants have burning questions, feel free to raise your hand. And panelists, I know you're busy, so you can just wave to your next step for the day. But thank you so much.